Hello and welcome back. It is a hot, sunny summer day in Manhattan. I thought it would be a great idea to shoot outdoors, but I'm a little sweaty, so please forgive me. We are doing biceps. You asked for biceps. Specifically, somebody said that their biceps tended to get really tight. This can happen from working out. We could get biceps tendinosis or tendinitis, usually from repetitive stress. We're a very flexion-happy society, and that includes our biceps getting really short in a shortened position and never really getting the chance to relax or stretch out. So I want you to just start by feeling what your biceps feel like. They run the length of your shoulder to your elbow. And just notice any tension, any pain or achiness, tightness, anything like that. And just take a nice breath. And let it go on a long exhale. And I want to start just by warming up the muscle. So just give it some nice squeezes, whole hand squeezes. Really grasp the whole muscle. You're not pinching the skin, you're grasping the whole thing. And give it a good squeeze. Already that should feel good. As a massage therapist, my arms work really hard, so this is always great for me too. And just squeeze up and down the whole length. You can go on the side and get the lateral edge of the biceps and the medial border. And go all the way to the attachments down at the elbow. And then let's just take like three fingers or four and make some little circles, just exploring the muscle, seeing what it feels like, seeing where, if anywhere, it's particularly tight or a little tender, or you might have a little trigger point. And if you do, just hang out there, put your pressure on, breathe in and out. Letting go of the tension on the exhale, and you can do some little circular motions to the area. And continue on your way, exploring whole muscle. It's best if your arm is as relaxed as possible while you do this. I'm actually resting it on my lap. You can do that, or just let it hang by your side. Great, and when you're done with that, we'll do a little active release. So we're going to be moving the bicep through its motions, which is both flexing the shoulder, extending the shoulder, flexing the elbow, extending the elbow, and supinating the forearm, meaning turning it palms up. So let's start with the shoulder. I'm taking a soft fist, and you could do this with a soft fist or you could do it with fingers. I find it easier to do a soft fist. Starting at the elbow, you're going to engage the tissue, so put a good amount of pressure and start to kind of lift the tissue up toward the shoulder. This is myofascial release. So you're not pushing it or forcing it, you're just engaging and then letting it release, sort of feeling it melt out. It's going to be slow. And while you do this, you're going to flex and extend down really slowly. Slow movements, feel it release. And your hand will start to creep up the arm as the muscle relaxes. If this feels very abrasive against your skin, if your skin is dry, you can use a tiny little bit of lotion or cream, but just a tiny bit, because you don't want to slide over the skin. You want to really engage the muscle and the fascia surrounding it. All the way up. Get onto that biceps long head tendon. All the way up to the shoulder. That relaxed my arm a lot. I hope it did yours too. So we're going to do the same thing, but this time we're going to flex and extend the elbow. So go ahead and engage, lift it up towards the shoulder, and we're going to flex and extend. Flex, extend it all the way down. To add a little extra stretch, flex, extend, and turn the palm down. That'll give it a little extra stretch. Come back, flex, straighten, palm down. And palm down. All the way up. Keep going right up the whole tendon, all the way up the front of the shoulder. Great work. And now, because that biceps long head tendon tends to get a little tendinosis or tendinitis or just be kind of stuck or tender, we're going to go right onto it, and you'll feel this big ropey, sort of ropey feeling thing. That's your biceps tendon right in the front of your shoulder right here. If you rub your fingers over, you'll pop over it. So you could do some of that, just sort of flip over the tendon to get it moving. You could also just do nice circles for the front of the shoulder. That should feel really good. Breathe. And then shake out your arm. Let's do a little stretch. So a great way to do a bicep stretch is to put your hands out behind you, palms down, and then walk your bottom away until you feel a good stretch. Take a nice breath into that. Just let them release. Should feel really nice now that it's been massaged. And slowly bring your bottom back. Come to a comfortable seated position. Take a nice breath in and out. Notice the difference in how it feels compared to before we began the massage, and also notice the difference between the bicep you just worked and the other one that hasn't been worked yet. It's interesting to notice, right? So go ahead and do the other one. If you liked this video, give me the thumbs up. Please subscribe to my channel. I've got lots of good stuff like this, and I will see you in the next video.